The reality for many people, regardless of what kind of medical problem they have, is that the rest of life comes into play. We all have busy, complicated lives that, depending upon which day you catch us, can either be amazingly simple or overwhelmingly complex. That is not changed by the fact that you may be HIV positive. What that means is that you have to begin to incorporate not only the disease, but what are the other contributing components that may influence the outcome of treatment. Example, if you have someone who doesn't have a car and can't get to the office except through public transportation, then giving them an appointment at 8 o'clock in the morning probably is not a very good idea for them because they're never going to be on time. If you have someone who doesn't have child care issues resolved, then giving them appointments that correspond to when they need to be at their school with their children creates problems. Some of it is just taking into account the fact that patients, clients, staff, clinicians, all of us have lives that you have to juggle around these various components. Clinically, you can throw in other kinds of issues. So if this person also has issues related to substance abuse or has other medical problems, cancers, high blood pressure, diabetes, hepatitis, you need to then coordinate not only what happens in terms of you getting to see me, but how does that influence the treatment and care of other things. You also have to take into account the complexity of those issues when you prescribe medications. We frequently will have people who are on medication for their HIV, but who are also getting additional medication for the other diseases. We need to make sure that there's not drug interactions or other kinds of complexities that may go on there. And then finally, it's just the sheer reality of, again, of volume. You know, we frequently are in our own world, go to see your doctor and you have a limited amount of time that you get to spend with that individual. That becomes very problematic if this person doesn't have the ability to come back and see you because of transportation or resources, or they work in a job where they don't get time off to go to the doctor on a regular basis. When you take time off, you just don't get paid that day. There are lots of those components that make it compelling for why we need to take this into account as we are dealing with everyone's health issues, but particularly with a disease where missing appointments or missing doses can develop in not only the medication not working for the individual, but the virus becoming resistant to the therapies and thus becoming even more of a problem if it is transmitted or for whatever new regimens we may have to use. That combination of both social as well as clinical components make HIV not unique, but a significant challenge for all of us who do it and for everyone who lives with this disease.